Okay, let's unpack this. Um, it's pretty wild to think, isn't it? That something as everyday as how you sleep could actually be affecting your heart health.
It really is. Most people just focus on, getting comfortable. They don't think much beyond that.
Exactly. But the source material we looked at suggests a really strong connection. We're talking blood pressure, circulation, even long-term risks like heart failure.
Yeah, it's not something to dismiss lightly.
So our mission in this deep dive is basically to explore that. We'll look at what the sources say are the best and maybe worst sleep positions for your heart and try to understand why.
Sounds good. It's fascinating stuff. What's really interesting is how active our bodies actually are during sleep. It's not just passive rest.
Right. The heart's still pumping, lungs are working.
Precisely. And how you position yourself can definitely influence how efficiently all that happens, the mechanical stress involved.
So let's get straight into it then. Why does our sleep position matter so much for the heart?
Well, fundamentally, it comes down to a couple of things. Blood flow is a big one. How easily can blood circulate?
Okay.
And then there's the actual physical pressure on the heart itself, depending on how you're lying. Plus, and this is crucial, it affects your breathing. How clear are your airways?
Ah, yeah.
And the sources are clear. This isn't just like a minor thing. If you already have conditions, high blood pressure, heart disease, sleep apnea, your position becomes even more critical. It can either help or hinder.
Okay, that makes a lot of sense. It's not just downtime.
hmm
So the materials seem to point pretty strongly towards one position being, well, better than others. Let's talk about sleeping on your left side.
Yes. The left side often comes out on top in these discussions, according to the sources. The main reason cited is reducing pressure on the heart.
How does that work exactly?
Because of where the heart sits in your chest, slightly to the left, lying on that side, lets gravity kind of help with blood flow returning to the heart. It might ease the workload just a bit.
Interesting. And I think I saw mentions of other potential pluses too.
That's right. Better circulation overall is one, and some sources even mention improved lymph drainage.
Lymph drainage, how does that connect?
Well, the lymphatic system is basically your body's waste disposal network. The theory or suggestion is that left side sleeping might help that system work more efficiently, which supports overall health, potentially including cardiovascular health.
Hmm.
And specifically for people with heart failure, some find this position more comfortable, though, it's always individual.
Gotcha. And there was a specific tip in there for people with high blood pressure.
Yes, absolutely. The advice drawn from the sources is if you have high blood pressure, try sleeping on your left side. Maybe stick a pillow between your knees that helps with alignment and comfort, and it's thought to potentially ease the heart's job overnight.
Okay, so left side seems to be the preferred option generally. What about the right side? Is that actively bad?
Not really bad, no. The sources tend to describe right side sleeping as more neutral. It's definitely not seen as harmful in the way some other positions might be. For some people, it might even feel better, maybe slightly reducing pressure on the heart compared to other positions. But there's a key caveat mentioned.
Which is?
For people with certain heart rhythm issues, specifically atrial fibrillation or AFib.
The irregular heartbeat.
Exactly. For those individuals, sleeping on the right side might actually feel uncomfortable or possibly make them more aware of their symptoms.
Any idea why that might be the case for AFib?
The sources don't dive super deep into the sleep mechanism, but AFib involves, irregular electrical signals. It's possible that lying on the right changes the heart's position just enough that some people feel those palpitations more acutely.
Interesting nuance.
It is. So for that specific group, right side might not be ideal. But for most people, the sources suggest right side sleeping is still significantly better than, say, sleeping on your back or stomach.
Right, so left is generally good, right is mostly okay. Which brings us to the one the sources seemed really concerned about, sleeping flat on your back.
Yes, this is where the warnings get pretty strong, especially for a lot of people. Even though it might feel comfortable initially, back sleeping is often flagged as potentially the worst position for heart health.
Particularly if you snore and have sleep apnea.
Absolutely. That's the critical link.
And the reason why is quite, well, mechanical.
It is. When you lie flat on your back, gravity does its thing. Your tongue and the soft tissues in your throat can relax and fall backwards.
Blocking the airway.
Exactly. Either partially or completely blocking airflow.
Which means less oxygen.
Precisely. Your oxygen levels drop, sometimes repeatedly all night long. And when that happens, your body panics slightly. Your heart has to pump much harder to circulate the oxygenated blood that is available.
That sounds like a lot of strain.
It is. The sources explicitly link this to a higher risk of blood pressure spikes during the night. And those nocturnal spikes are associated with an increased risk of stroke or other major cardiac events.
Wow.
So the advice is very direct. If you have high blood pressure, heart disease, or you have breathing issues like snoring or apnea, you should really try to avoid sleeping on your back.
That's a stark warning based just on position. Okay, what about the last one? Stomach sleeping.
Also, generally not recommended. The sources put it as not much better than back sleeping, really, just with different potential issues.
Like what? I know it's not great for your neck.
Right, neck and back strain are common because you have to twist your head. But from a heart perspective, lying on your stomach can slightly compress your chest cavity. It might make it just a bit harder for your heart and lungs to function optimally. Not as dramatic, perhaps, as the airway blockage on your back, but still not ideal for efficiency.
And does it affect sleep quality itself?
Yes, that's another point the sources raise. Stomach sleeping can often disrupt sleep, particularly the deeper stages. You might toss and turn more trying to get comfortable.
And why is disrupting deep sleep bad for the heart specifically?
Because deep sleep is prime time for recovery. That's when your blood pressure naturally dips, your heart rate slows down, and your body does essential repair work on tissues, including heart muscle and blood vessels.
So, cutting that short is robbing your heart of that maintenance period.
Exactly. You need that restorative phase for long-term cardiovascular health.
Okay, so we've covered the pros and cons based on the sources. Left is generally good, right is okay for most, back is risky, especially with breathing issues, and stomach isn't great either. If you pull all that together, what are the main sort of actionable tips from the experts cited?
Well, the number one piece of advice is try to favor your left side. Make a conscious effort.
Okay.
Number two, use a supportive pillow, not just any pillow, but one that helps keep your spine aligned. Good alignment helps with breathing too.
Makes sense.
Number three, this is a big one. If you snore or have sleep apnea, actively avoid sleeping on your back. Maybe use pillows to prop yourself or look into other strategies.
Right. Crucial.
And number four, if you tend to get heartburn or feel short of breath at night, try elevating your head slightly. A wedge pillow or adjustable bed base can help there.
So it seems like it's not just the position, but also things like alignment and elevation matter too. And the overall quality of sleep came up as well.
Absolutely critical. The sources really emphasize this. A consistent sleep schedule, getting enough hours of quality sleep, that's just as vital for your heart as finding the right position. Think of position as one tool to help improve that overall quality and reduce specific strains.
So wrapping this up, it really does seem like this simple choice, how you lie down, could have a real measurable impact on your heart health over the long run. It's less about just crashing out and more about maybe actively supporting your body while it rests.
That's a great way to put it. And the encouraging part is that even a small change, like consciously trying to sleep on your left side more often, could potentially lead to better rest and maybe offer some protective benefit for your heart. It's empowering in a way.
Definitely food for thought. So for everyone listening, thinking about everything we've just discussed from the source material, maybe what's one small adjustment you could realistically try tonight? And perhaps pay attention, listen to your body over the next week or so. See if you notice any difference in how you feel when you wake up based on how you slept.